Hello, I'm Dr. Liana Leonoff. I'm the president and founder of the Global Positive Health Institute, and welcome to the series on meaning, purpose, and spirituality in lifestyle medicine and healthcare. And today I'm delighted to have with us Dr. Cate Collings. She's a past president of the American College of Preventive Medicine, American College of Lifestyle Medicine, and she is an accomplished cardiologist, is currently also the delegate to the American Medical Association on behalf of the American College of Lifestyle Medicine. And she's newly in this area of executive coaching. Welcome, Cate.
Thank you, Leanna.
And let's get right into it. Speaking before we started recording, and some of our audience who've been following these interviews are aware, the American College of Lifestyle Medicine is working on a project around all these important areas of our lives, this purpose, meaning, spirituality, religiosity, that this is an important element to start thinking about how do we better address it, incorporate it, harness it, leverage it, whatever you want to call it, within healthcare and medicine, because we have not done such a good job with that. It's particularly important in lifestyle medicine when we're helping individuals with healthy behaviors. And so their whys and what drives them is going to also drive their healthy behaviors. So that's just a little preamble about how do you think first this element affects you personally, and then how can we start to incorporate it with colleagues and patients professionally in healthcare?
Yeah, I mean, I would say that, where lifestyle medicine, I think the field of lifestyle medicine has a lot of innovative thinkers and a lot of people who are willing to be a little bit vulnerable. And I think that those individuals, those practitioners can then open up questions to their patients, maybe in a bolder way than they might have before, and to ask some very intimate questions like, what matters to you? How does spirituality fit into your life? What creates meaning? Tell me about your family. These are questions, tell me about your spouse. These are questions that often fell out of being in discussions because medicine, and I saw this over the 3 decades, went from asking those social questions that made you connected to the individual, and then began to, with the incorporation of the electronic medical record, distracted the physician, I think, from some of that intimacy and pushed them into a more of a robotic function and a data collection. And I think that moved medicine a different direction, and patients didn't feel heard. They didn't feel known. And I think lifestyle medicine opens the door and draws people who want to still foster that. They want to know their patients. They want to heal. And I think it's that which has this beautiful bidirectional effect, both by patients saying things like, wow, I've never had a physician ask me these or listen so carefully to my answers or care. And that goes back and in terms of being so rewarding to somebody that is the healer, that's the provider. You can do a lot of healing through those kinds of things alone. It's just amazing how much people begin to trust and feel in connection and begin to take better care of themselves. It's, even without a laundry list of things they need to do, right? It's really the connection. So how that's expressed in terms of spirituality, how that's expressed in terms of oneness with other people. This is hopefully what will come forth in the summit and a lot of the work that you're doing.
Yeah, well, thank you for that. It is just chime in on the last thing you were saying. Individuals, we all need to feel seen for who we really are,
Mhm.
and embraced for who we really are, and our beliefs and the whole package, and that sense of being fully seen and fully embraced is very healing. And a
Mhm.
huge part of that is what drives us day to day, what gives us meaning, what we believe in,
Mhm.
yeah, and how we conduct our lives. And part of that therapeutic alliance, certainly, between
Mhm.
patient and provider. So
Mhm.
that's terrific. And we skipped over a little bit. I'd love to hear more about how it helps you with your well-being more personally.
Mhm. Well, I think, I think when you have any close discussion, I'll say intimate discussion, where somebody shares a part of themselves, maybe it's a vulnerability, and maybe there is sharing the other direction. Um, Again, I think that it allows, if you will, the provider, in that case, the healer, to feel heard and seen as well. So it's so bidirectional and rewarding. Um, and, it just doesn't happen without kind of stretching yourselves a little bit, you and the patient kind of going to some topics that may not be standard. But and you don't get those things if you don't sort of branch out, reach out, and extend a topic and see where it goes. So I think that it's so rewarding. All of my encounters with patients that have had to do with life and death have been rewarding for me, to be part of their life and to be honored to share in some of their thoughts about life and death and what is meaningful to them. And yeah, that's really what I take away from the years of clinical work. Is not like some medicine that got developed or some procedure that got developed. It was the conversations um, where people felt I'd helped them. They expressed that. I learned something about their life that brought value to me. Um, and yeah, those are the rewarding things. I wish I had documented them in a book uh, while it was going on.
The stories,
Mhm.
yes. But it sounds like you're carrying the warmth of those memories of those special connections with you forever, even if
Yeah,
you're able to document the details.
right. Exactly. Exactly. Yeah.
And personally, have you experienced how meaning, purpose, spirituality has helped you with health behavior change or physical health? Of course, it helps us with our emotional connections, but is there
Mhm.
other
Mhm.
ways that this area has helped you in your life?
Well, I think the more one sort of tunes in to the spiritual side of things, there can be a very positive introspective element to that. And I think with that, then it offers the possibility of, self-inquiry, but also with compassion, right? Why do I do what I'm doing? And where is that helping me or not helping me? So taking a look at that in as it relates to some health behavior. Um, so I think without being psychoanalytical about it, I think somehow the centering and the time, I call that spiritual time, really almost a centering time. Again, because I'm not looking to a god or any other deity. So I'm really looking at myself and the world around me and the people I connect with, and making intentional efforts in all of that. And that does, I think, lead to a lot of aha moments for myself and my own personal behavior. Um, yeah.
Yeah.
And from there, you can launch into, is there something different? Do you want something different? Do you want to have this experience be different?
Yeah.
Yeah.
And move in the direction of proactive goals for
Right.
ourselves and our
Yeah.
well-being, our health, behaviors, and so much more.
Right.
Our life, where we're headed with our lives, and then it comes down to that life satisfaction that is so crucial. We talk about that in positive health and the GPHI, that has physical consequences as well.
Mhm.
Indirectly and directly.
Mhm.
That's why it is wonderful that we're taking on this topic to really dive into it and really see how we can leverage it, yet be very scientific about it,
Mhm.
and
Mhm.
have to acknowledge that we're missing so much. We need so much more research in terms of how these pieces connect. But in the meantime, we have seeing patients on a regular basis. We're living our lives on a regular basis, and it's wonderful to have these pieces to support us and to acknowledge these
Mhm.
pieces and integrate them into our
Yeah.
lives.
Yes.
So thank you so much for joining us, Cate, and sharing some of your thoughts and wisdom and personal stories on this important topic. And thank you to our listeners to this Meaning Purpose Spirituality series. Hope you join us for another one of these. And please check out some of the other videos at the Global Positive Health Institute. And be safe, be well in the meantime. Take care, everybody. Bye-bye.